Okay, now let's talk about direct bracket bonding. Even if you choose indirect bracket bonding for your initial bracket placement, you still need to know how to directly bond brackets. Now, our standard bracket heights are shown above, and we have our bracket heights for shallow and open bite cases shown below. Now, in order to set those precise heights, we use the bracket height gauge. This instrument has the four most commonly used orthodontic bracket heights: 3.5, 4, 4.5, and 5 millimeters. And how you use this gauge is you place the flat part, that big fat part, right on the incisal edge. And then that thin tine with the measurement you want goes right into the bracket slot. Now, when you're using this gauge, you want to make sure that you have it set to about 90 degrees to the long axis of the tooth. You don't want to tilt it way down low or way up high, because that can alter the bracket height on the tooth. Now, the molar tube doesn't have an open face slot. It's a tube, okay? So you can't get the height gauge in there. Also, you know, the cheek's going to be in the way. It would be very difficult to position that bracket height gauge anyway. So what we do is we place the center of that tube right on that buccal pit, right in that buccal groove. That's going to get you where you want to go 99% of the time. So you etch, rinse, dry the teeth that you're doing your direct bracket bonding on. Now place your orthodontic bonding agent. And again, I don't cure it. I cured the bracket and the bonding agent all at the same time. Now you're going to have that bracket preloaded in a reverse action bracket holder. Reverse action means when you squeeze, it lets go. I like this much better than cotton pliers or tweezers, something like that. It can be locked and loaded, ready to go. You place a small amount of orthodontic cement onto the back of the bracket. Then you're going to press the bracket against the tooth nicely and firmly, okay, to make sure it's really seated against the tooth. Then you're going to squeeze that reverse action plier to let go. Now you're going to come in with that bracket height gauge so you can set that precise height of the bracket on the tooth. Now what you're going to do is you're going to check your mesial-distal centering of that bracket, first from the facial aspect. And it should look something like that, right? You have the center of the bracket right along the center of the tooth. Now, very important, probably the most important bracket placement trick you're going to get. Now double check it from the occlusal view. Now, why is this so important? The reason it is so important is, I don't know about you guys and gals, but I don't straddle the patient when I'm looking at him from the facial view. You're always looking at them kind of from the side, aren't you? Okay? So that can give a bit of an optical illusion that makes you think the bracket is centered when it really is not. But when you're looking straight down on that incisal occlusal view, you can see if the bracket is centered mesial distally. Okay? So make sure to double check that centering from the occlusal view as well. And take your instrument and put it right on there, okay? Whether it's a perio probe, sickle scaler, explorer, whatever you're going to be using to clean up the extra cement afterwards works great. Double check that centering. That's exactly what I do chair side. Okay, and if it's off center, like this bracket here is off to the distal, right? All you have to do is tap that bracket a little bit to glide it over to get it in the proper position. Now, this is one of the reasons why I prefer, like here, orthodontic cement as opposed to flowable composite. Flowable composite, you tap that bracket, it has a tendency to go, okay, and really glide on you. That, like here, cement, you have much more control to those fine-tuning movements. Okay, now you're going to check your bracket rotation from the facial. Make sure it's rotated properly, counterclockwise, clockwise, okay? And it should look basically something like this. A good way to think about it is you want your bracket slot parallel to your incisal edge. Another way of thinking of it is perpendicular to the long axis of the tooth, right? Okay? Or the long axis of the bracket slot, okay? That's harder for some doctors to visualize, though, in the mouth. Okay? And you can just take your instrument. Make sure that bracket slot is parallel to the incisal edge, okay? Now you should have the bracket in the proper position in all three dimensions of space. You have the proper height, the proper mesial-distal centering, and the proper rotation. So that means that nickel titanium archwire can move that tooth far more precisely to that tooth's final position. Okay, next clinically you would clear off any extra cement you may have, and then just go ahead and light cure. And now you're ready to place, position, and cure the next bracket. And if you're going to be doing a lot of direct bonding, like a whole arch or a whole mouth, okay, make sure to get enough of these reverse action bracket holders, okay? You want them all locked and loaded. You don't want just one where you're picking a bracket out of the package, then fishing out the next one. Get a whole bunch. They're not very expensive. Get as many as you need. The ones on the ends are actually reverse action molar tube holders as well, okay? So those are really cool. You're going to want to have some of those too.